my name is Angelica Alvarez, and I'm going to be the chairman arguing for the healthcare team. As chairman, a member of the healthcare team assigned to Mr. Schmidt, I believe it is in everyone's best interest to keep Mrs. Schmidt out of her husband's room in order to give the healthcare providers the focus that they need without any disruptions from any distraught family members. It would also be dangerous for Mrs. Schmidt to be in the room during resuscitation, seeing as how nobody knows how poorly she may react and the trauma she may endure watching it be done to her husband. Lastly, respect for patient privacy is another reason Mr. Schmidt's wife should stay outside the room. They are happily wed, but because Mr. Schmidt is unconscious at the time of the event, the healthcare team does not know whether or not the patient would have wanted his wife to be there. Like anyone would, I sympathize with Mrs. Schmidt. It must be difficult from an outsider perspective to watch a loved one within hospital rooms. However, in order for the physician to prioritize and give all their attention to Mr. Schmidt, his wife must leave the room to avoid imposing any sort of distraction due to her distress. Anything taking away focus from performing cardiopulmonary resuscitation may provoke a risk to the patient. In a 2016 article by John W. Entwistle, he explains the scenario of family being in the room and makes a fair point by stating that the presence of patient family often raises high levels of stress on the healthcare providers. It reduces the chance for the healthcare team to communicate with each other on the status of the patient due to multiple questions being asked by family and loud cries from emotional distress. In the end, as great as it is for families to be in the room as support, nurses and the rest of the healthcare team need to maintain the ethical principle of non-maleficence, meaning they should decide on how to further remove the patient in need from any possible harm, which could include the disruption of their fellow family members. Mrs. Schmidt's plea to stay in the room during an emergency procedure comes from a good place. She wants to be with her husband, who she loves dearly, but must understand the danger she may be putting herself in physically and psychologically. When the resuscitation occurs, our patient's wife may be so overwhelmed with emotion, which can possibly lead to her experiencing syncope. Code situations are anarchic. The situation entails various members working concurrently, using and being near sharp surgical instruments, and in the case that a family member does pass out, the possibility of them falling on one of these instruments and harming themselves is present. Bodily fluids may be scattered, and the risk of exposure to an outside member is a risk not all individuals are prepared for. There is also a concern that families will have a traumatic reaction or negative memories from witnessing resuscitation. This event can follow Mrs. Schmidt and disrupt her daily activities. It may be hard for the patient's wife to forget about what she has seen if she were to have stayed in the room 212 during Code Blue. To conclude, during resuscitation, there is much detailed information being yelled out and exposure of the body of the patient, who is in a state of comatose and is not oriented enough to state whether they are comfortable or not having another member of their family in the room. It is the job of any member of the hospital assigned to a patient to practice their fidelity to their patients, advocating and giving them the greatest treatment you can, providing the loyalty you have to their case and ensuring you are a trustworthy member to the patient and keeping their information confidential until they are able to tell you otherwise. CNO practice standards on disclosure without consent strictly states that those who seek any access to a patient's medical information need to have authority before requesting any information. Otherwise, there may be consequences, and the reputation of the hospital could be at risk if information gets released that the client was unaware about.